right, thank you for that. Our second panelist is Aidan Scheim. He is a PhD candidate, Trudeau Foundation Scholar, and Vanier Scholar in Epidemiology and Biostatistics at Western University. His work examines research methods, health outcomes, and access to care for sexual and gender minorities, people who use drugs, and other communities experiencing and resisting stigma. He is a founding member and past chair of the Trans Men's Working Group of the Ontario Gay Men's Sexual Health Alliance, and he is joining us through Skype.
All right. I've never presented by this technology before, so we're going to hope it works. Can you hear me? Yes. Excellent. All right.
How am I supposed to tell him about the 5 minutes?
Great. So I think it fits really well what Cyrus was talking about and what I'm going to address. I'm going to try in 10 minutes to cover some of the highlights around research on trans men and stigma. I won't do it justice in 10 minutes, but Cyrus has done a great job of speaking to some of the qualitative research we've recently been doing in Ontario and elsewhere. I'm an epidemiologist, so I'm going to speak more about quantitative research, and hopefully that'll fit together well for you. So just briefly, to contextualize stigma and trans health, I think it's important to think about anti-trans stigma in a larger context of cisnormativity, which is a concept that some of my colleagues developed in the paper that's referenced on the right here. And cisnormativity is the assumption that everyone is, should be, and will be cisgender, and that results in turn in erasure in informational settings and institutional settings. And so what's interesting is that this informational erasure has been really compounded by stigmatizing attitudes around trans identities. Until quite recently, the only research available on gay, bisexual, and other queer trans men was really focused on insisting there were rare pathological deviations. So I really like this quote from 1987, that female gender dysphorics, which is their way of talking about trans men, almost without exception, are erotically attracted to members of their own anatomical sex. 13 years later, we see a quote from researchers that continues to use language that denies people's identities. So very confusingly, they talk about gay trans men as non-homosexual female transsexuals. Take a moment to wrap your head around that. And continue to insist that relatively rare and not seen in gender clinics. Of course, as Cyrus alluded to, trans men who are attracted to men were not seen in gender clinics because people who reported same-sex attractions were not allowed to transition. So shockingly, they didn't tell the gender clinics that they had same-sex attractions. 13 years later, and that's just a coincidence that the timing happens to be spaced evenly apart, we now see research being conducted that is community-based and community-driven, that isn't pathologizing trans identities. We've also seen the emergence of really vibrant trans men's communities in cities and towns across the world, and more community and acceptance for trans men who are gay, bisexual, or queer. And so we now find, in fact, that 63% of trans masculine people in Ontario identified as gay, bisexual, or queer, or had sex with men in the past year. So we've gone from being a marginal minority to the majority. And something I really want to really quickly highlight is just the diversity within that category of trans men or trans masculine people. I'm using those terms as a broad umbrella, but you can see on the left wide diversity in terms of how people identify their genders, and on the right, wide diversity in terms of the steps people take or don't take. Sorry, message here. Sorry, Olivier Ferlate was messaging me, and I thought it was an urgent thing. It's all good. Moving along. But you can't hear me. You can see diversity in terms of how people have taken steps or not taken steps to socially or medically affirm their gender. So some people who are living in their felt gender without taking any steps to medically transition, others who say that their transition is complete, whatever that means to them, and then everything in between. I could talk a lot about all of the horrible ways that stigma impacts trans health, but I don't want to depress you, and I want to focus on some of the things we can do to challenge and undo stigma. So this is an image from a study that we published last year in BMC Public Health, and it looks at suicide risk among trans people in Ontario. And so we found that currently 35% of trans people in Ontario would consider suicide in a given year. And we looked at the associations between stigma at the social level, at the policy level, and in healthcare. And what we asked is, if we were able to change the level of each form of stigma in the population, might we be able to reduce the number of people who consider suicide in a given year? And so what you see at the lower level here are the projected proportion of trans people in Ontario who would consider suicide in a given year, with a hypothetical intervention to change one factor at a time. And we estimated that there's a potential to reduce the proportion who consider suicide from 35% to somewhere between 19 and 24%, if we could do things like ensuring that people have access to legal identification that matches their lived gender, by decreasing experiences of transphobia, increasing social support, increasing parental support for one's gender identity, and increasing access to medical transition for those who need it. And one exciting thing on that front that I should mention for those who are in the room from Ontario is that the government just announced while you were sitting in the session that they're going to be greatly expanding access to surgery for trans people who need it within the next year, allowing referrals from any qualified healthcare provider, rather than we're forcing people to go to the gender clinic at the Center for Addiction and Mental Health. So that's a huge victory. I love being the person who gets to share good news during a panel. I was recently at the International Harm Reduction Conference, where Liz Evans, formerly of Insight, got to announce that Harper lost the election during her keynote. So I'm feeling a similar level of excitement about this. Anyway, moving along. I want to talk a little bit about stigma and access to care as well, and just give some examples of ways that stigma impacts access to care. So we found in Ontario that a fifth of trans people reported having avoided the emergency room when they needed it because they were trans. And this is really staggering, because if you consider, when you need to go to the emergency room, you need to go to the emergency room. And so if this many people are avoiding emergency care, it's reasonable to assume that even more people are avoiding less urgent forms of care. We also found in a study with the Global Forum on MSM and HIV, in a paper that's currently under review, that when we looked at access to HIV testing and to low-cost condom-compatible lubricants, that trans men who have sex with men were less likely than cisgender men who have sex with men to have access to these services. And we did match them on key demographic characteristics to know that that wasn't the cause of the differences. And this supports what we found in the work that Cyrus was referring to, that trans men report problems accessing HIV and STI testing and other prevention services. And this is particularly so in sexual health settings that are focused on gay, bi, and other MSM. Thinking a bit more about sexual health, we actually find in the quantitative research that does exist that HIV-related sexual risk among trans men overall is lower than among cisgender men overall. But it's a bit hard to tease apart because many of these studies are including large numbers of trans men who aren't sexually active with cisgender men. And HIV risk, almost by definition, is concentrated in those having sex with cisgender men. Similarly, the data we have on HIV prevalence are very limited and hard to interpret. So the estimates that exist range from 0 to 6%, but some of those studies don't separate out trans men who are sexually active with cisgender men. Some of those data are getting very old, and we know that trans men are increasingly a part of gay and bi men's sexual cultures. So there's a real need for new data and continued monitoring. Related to that point about participating in gay men's sexual cultures, some really interesting work as part of the trans MSM study, looking at how people's ability to access the sexual partners they want to have really depends on how they're being read as male, and this idea of passing. And then even once you kind of get in the door, stigma can really impact your ability to negotiate safer sex or the kind of sex you want to have, because you feel like you shouldn't give up an opportunity by insisting on having sex the way you want to have it. And there's also a paper that was just published by Sarah Reesner and his colleagues in Massachusetts looking at syndemic conditions, which we know are fueled by stigma. And they found that syndemic conditions increase sexual risk among trans men who had socially transitioned, just like we know they do among cisgender men. Another thing I want to bring attention to in terms of talking about stigma is that one thing we need to challenge is the stigma of talking about vaginal sex between trans and cis men. This here is data, again, from Transpulse in Ontario. And if you look at HIV-related risk among trans men, almost all of it was related to receptive genital or vaginal sex, and very little related to anal sex. So this is the sex we need to be talking about, despite the fact that some people are uncomfortable doing so. Finally, I want to talk a little bit about what's next in terms of considerations for challenging anti-trans stigma through research. What's really promising is an increasing trend towards inclusion of trans men in studies of gay, bi, and queer men. Most of the research I've talked about was from studies that were focused only on trans people. But more and more, we're seeing inclusion of trans men in gay men's studies. The Sex Now study is a great example of that. And there's some important points to consider when we're thinking about this. So one point is that we need to identify trans respondents. The common way to do that is known as a two-step method. You ask people about their gender identity and about their sex assigned at birth, but that's not enough. We also need to consider things related to the diversity of identities and transition statuses that I spoke about earlier. For example, it's often relevant to know if people are living in their felt gender full-time, because the experiences of people who are going to be really different than the experiences of people who are still presenting as female in their day-to-day lives. We need large enough samples to actually analyze the data. There's no point in including people in the study only to discard their data because you had 5 trans guys. And so what's really important for doing that is having a targeted outreach strategy or a plan to do that. Chase made some videos to promote Sex Now that were really helpful in getting a large sample of trans guys for that study. Also important to think about capturing experiences that are specific to trans men, as well as those that are shared between trans and cis men. So for example, when we're thinking about measuring healthcare access for trans people, it's really important to ask about access to transition-related medical care. And finally, it's important to consider the fluidity of gender identity and sexuality for some, but not all trans men. One thing that's really interesting is that while the majority of trans men in Ontario did not identify as straight, most of that was guys who identified as bisexual or queer, and not necessarily as gay. And in general, in this field, we haven't done a great job of addressing the specific needs of queer and bisexual men. And so that's something for us to consider, as well as considering how we make room for people who don't necessarily identify as male, but who are a part of gay, bi, and queer men's communities. So I've said enough, I'll leave it at that. I want to acknowledge the research projects I work with who let me share data today, and my funders, and my email address is there. And thank you for my patience with learning how to present this way. And I look forward to questions if there is time.